are 0. But I'm very gentle. You see, I'm not kind of like trying to do
shake. Yeah.
So I'm kind of, they say kind of, they have a special instrument that does it too. But I don't like it because it gets the blood in there.
Gets the red blood.
What speed is the one you use?
The one 3200 ramp and for 12 minutes. The centrifuge. But there is another one that is kind of, you know which one I'm talking about, that moves it back.
Oh, yeah.
That, but
Yes.
it gets the blood in there.
yeah.
So I think the best I found is your hand by just mixing it like that. And I think it's released it. So you can see like a little, you see that film that is kind of released in there?
Yeah.
So that's it. You got it. So just, can I have some alcohol, please?
Okay.
Bourbon?
All that.
Yeah.
And I would suggest for everyone to wear goggles when you're doing this.
Oh, okay.
Can you bring my leaves?
Did you bring numbing cream? My sticks? I'm supposed to put it on a couple minutes here.
Yes, ma'am.
I think she says numbing.
This is the first thing to do.
Say again? Oh, see, it's set on the side of the TV.
So, can you have that trash, please? So, now, so I wanted to show you what the kit comes with. So there's the tip of your microneedling comes, that's the handle. So, and then there is the cover. So it's very important you put your handle in the cover. So, and one of it comes off, and then this part stays, and you take this off, and you put that in here, and then stick it, and then the other part comes off as well. So this is ready. So this is covered. So you're not contaminating your handle with blood products. Okay?
Do you autoclave that in between, or do you just wipe with
No, you just clean it with the
like Nanoside or something?
yes.
Okay.
And so now I'm gonna put the tip on. Do we have the people cleanse? صورتی هستش تو اتاق ماما؟ So you can see that it's going back and forth. Okay. It sets on 0.5. So I'm going to keep it on 0.5. So now, the other thing that is very important, you're going to see, I'm going to clean her face with HepaCleanse. HepaCleanse is dangerous for the eye, so you have to be very careful not to get close to the eye, but you clean the skin. So that's very important. Your skin has to be sterile or cleaned up. So can I have some 4x4s?
Yes.
And don't put it in there. I don't want this to go like that.
She's got a sweating problem.
Yeah.
You're gonna Botox her to get rid of that.
All right.
With
4x4 tablets. So I get close to the eye, but not near the eye. teach this to all of my nurses and my estheticians. They have to follow what I tell them. And I don't usually provide the service, so I don't do this. So this is done by my esthetician and my nurses. So this is done. So I'm ready. So I'm gonna start treatment. So if you don't mind, I'm gonna put her down because I feel more comfortable if I'm down and if the PRP don't drip down on her face. So I'm gonna put her down. اگه چیزی شد به من نه. But the only thing is که سیمی یه چیزی بذار زیر پاش که خسته نشد. So I can tell you, my nurses are much more expert in doing this than I am. Because, you know, they know better than me. Oh, you want to be able to tap man. Perfect. Sorry about that. So I'm going to pull this so you can come around. So everybody should be comfortable. If you guys are comfortable, then we can go ahead and start. Okay? So what I do, I use the PRP as my glider. So I do that, and then I start. And I'm on 0.5. So I wanted to see what the reaction is. I don't see anything. So I'm going to change it. So the tip is not all the way. You can do it either here, but it's not enough. So that's the reason I was saying that you need to know what you're doing. So this is, they say 0.1, 0.5 on the forehead, but it's not, as you can see, it's not doing anything. So I'm going to 0.75 and I'm going to see what it does. Yes, I'm starting to see, and this is perfect results. This is what I want to see. I don't want to do any more, and I don't want to do any less. So you can do a circular motion here. And I break down the face to different sections, and I treat different sections differently. So this is for this section. So we're going to go to this side. And I see the blood, so I know that I'm in a good layer. But I don't want it to be bloody face. راحتی عزیزم؟
درد نداریم؟
Okay. And then this is should be the same. Up to here should be the same kind of skin thickness. This is thicker. This is very thin. So this is, I'm going to treat different setting. So I'm going to go ahead with the same setting as the forehead in this area. And I'm going to put PRP again. And I'm going to add some more here. I'm going to massage it in.
What happens if you're an African American that you really can't see that redness?
It's not the redness, it's the blood.
It's actually the blood you want to
Yes.
see.
But you actually, you know, like you think about that in terms of some dermal rash that they come in with, you still are able to visualize it, you know, the tree, but I'm not sure, obviously not
So
saying.
I can really see it, like, I had it up.
I don't see the response, so I'm going to go up a little bit. So that's the reason I was saying that the setting is what you see, what's the skin response. And it is true because we're getting to the cheek area, so it's a little bit thicker. So that's the reason you don't get the response that you're looking for. And she's going to get a bruise. Okay. So that was the, so even with eyelid C is not that bad, so it's easy to treat. So, and I would say please do treat, guys. So I'm gonna have the face. So I'm gonna treat this area, but you see, I'm gonna go to 2 probably. So I'm gonna go to 1.5 to see what the response is. And if I see that I don't get it, then I go increase even higher to 2. The 2 is the maximum I'm gonna get. I'm gonna, gosh, it's okay. Now, who was the oculoplastic person? So what I do, I do this, and I put it in a bottle for them, and I tell them to use it as an artificial tear 2-3 times every hour or 2 hours, and until it's finished. And they keep it in the refrigerator.
Yes, okay.
So, see that it went in there? Actually, it's good for them.
So how long do you, how, you just treat them until it gets better? You know what I mean? Yeah, they can be on
They
it for
love it.
months.
They come back.
Yeah.
I'm telling you, they've been to every doctor, and they didn't get any treatment. And
What condition are you treating?
severe dry eyes,
Oh, okay.
Sjogren.
Yeah.
Me.
That was awesome.
Yeah.
So you're using the VR, same VR?
Yes.
Just the solution.
Yes.
Now, how much do you, I know we're in different states, so the cost is different, but my doctor was wondering, like, what could she charge?
We charging about the 300.
300, yeah.
Yes. I'm gonna go down because she's thinner here, so I'm gonna go down to 1. See, I don't like to get this. See, this is. See, she
Yeah,
got.
it's like
She's
bruising.
okay. This is. But I know my mom. My mom's skin is so sensitive. So that's okay. But I'm gonna go down on it. So I'm gonna treat this area a little bit less aggressive. And I want to put some more.
Would you, in the case of the dry eye, and would it be, you would think about opportunity to do it like a double plug prior to, just so that you could have the liquid gold there remaining?
They've been
a little
already
longer?
through everything. So the
Okay.
patients, they've already have the plugs, they have OcuSurge. The people I'm talking about, they're not regular patients that they have dry eyes. And you shouldn't do that because, think
Kinda like
about
a
it, God forbid if they get infection, you don't have any way of supporting, why did you do this? Because there's no preservatives in it. And it's, so I think it wasn't enough. So I'm gonna go to 1.5. Because I have to get some kind of a response. So even though I went 3 times and I was worried she was gonna get like that, I don't like what I see. So, do you see what I'm looking for? And that's when it's effective. So I change it to 1.5 and I'm gonna treat it again. And there is no problem to treat it again because you're not in the level that you want. So 3 passes like the way we are doing. Now I'm getting it. See, I got it now. I got what I wanted. So I got that micro little pin. So
Is it bad to do a lot of passes with a lower depth, with a shorter depth? Or, can you kind of get to the same point eventually, or no? It's better to go
It's the
higher
depth.
with less.
it's the depth. It's
Okay.
where you want to be.
Okay.
Remember where is the collagen formation? Is you want it to be in the specific part of dermis.
Okay.
Epidermis doesn't do anything for you. It does maybe some. I would leave it at Dr. Chaudhry to explain it. But really, you want it to be a specific part of dermis. So that's the reason I want that response. I don't want it to be deep, then you're in the muscle, and you're not doing anything.
And if it's superficial and you
It's
just
not
keep
doing
doing a
anything.
lot of it,
It's
it's
in
just
the epidermis.
irritating.
That's
It
called
perceive-
microdermabrasion.
Okay.
So that's not really doing anything. So
Okay.
that's the reason it's so important where you are.
Mhm.
And there is no, except the response you're getting back, it tells you where you are.
Okay.
Oh, let's
And
try
it
to
shouldn't
again.
take like 4 passes to see that.
No.
It should be like
No,
within that pass you see that.
You saw me,
response.
I did 3 passes,
Yeah,
I didn't get
that's
it,
a
so
little
I don't
different than us.
care.
We've been doing more passes, huh?
Yeah, so,
To get them pink.
Mama, Hubi? You okay?
I'm okay.
So I'm gonna go back up because we did the other side. So, I'm gonna go up a little bit. And then,
How long will she stay bruised?
no, she's not gonna stay bruised. I don't want her to be bruised. That was kind of a complication, I would say. And it's good for you guys to see it because we don't wanna get that. They're not supposed to have a bruise. But my mom is very thin, very thin skin.
And she'll forgive you.
Yeah, right, exactly.
Sorry, don't smile.
Are you at like 1.5 right now?
No, it's a little bit less than 1.5 because I got bruising on that side, so I
Okay.
don't want to get the bruising.
Now, is this her first time ever receiving
Yes.
this? Yes.
She never let me do this.
Thank you.
Did you tell her she has to come back at least 3 more times?
So you see, she didn't get the bruise on this side, and I was just a little bit less. It was almost 1.5, but because I liked the response I
Yeah,
got, I
much
just didn't
better.
like the bruise.
Yeah.
But she didn't get the bruise on this side. So I'm gonna go a little bit to on the lips. And I'm gonna see if I get too, I don't wanna be in the muscle. So one thing is, you be in the muscle, you're really not doing anything again.
Right.
So if I see it's too much bleeding, I go back. So that's the reason I'm kind of questioning when you say you don't get any response with 2. What are you doing? Are you pressing? Or very few people in their face are more than 2 millimeters somewhere thick, unless you are a male on the cheek area. They can be 3 to 4 millimeter thickness of skin, but or not the skin. I'm talking about the epidermis, because you're supposed to be in the dermis. So I don't know anyone who's that thick skin. But we never say never to in medicine, you know.
Well, they always say African Americans have thicker skin, so
Yeah.
But
I
not
forgot
that
about
thick.
The eyes. Yes. So I'm gonna go a little bit for the eyes. So let's do the eyes.
at any point do you change the attachment because it starts to
Be dull.
Dull.
yes,
Yes.
dullness?
If they're thick skin,
That
yes,
gets duller.
then I would do that. I'm sorry, but I don't have my goggles because I forgot my goggles, but I really recommend not to do this without glasses. Because remember, you're dealing with blood products and you don't want it to be in your face. That is my mommy, so I don't care even if it gets in the way. She doesn't have any problems and I know her history. I don't care if I get it splashed. But I wanted to re-emphasize, I mean, that's very important for you guys to protect yourself. I'm not getting the response. See, one side is a little bit thicker than the other side, so we need to increase it a little bit. Now I'm getting it.
Now, does she need to be bleeding like in every pinpoint that you do, or as long as you see response in some of the spots
That's
that
it,
you're treating?
that's all. I'm doing enough that you should kind of get a feeling, what am I looking for?
Right.
They have a glider, by the way. I just don't use it. I'm not a fan of using any other product on the skin when I don't have to. I don't know how Dr. Chadwick feels about it. Are you like me, conservative, don't like anything on the skin?
You know it. Yes.
Yeah, so, because we know, you know, the more you know what can happen, the more conservative. Nose is very thick, so you can go up to, I would say, 1.5. Let's go a little bit less. Let's do 1.25. I'm gonna do some more on these areas. Homophobia. Over the nose.
Is it 0.5 on that?
0.1 to 1.25. Yes, I'm getting, because nose is hard to get bleeding. So it's even just a little bit is good enough. Turn on my first. And it's very painful, by the way. The nose is very painful. is very good treatment. Now I'm gonna do the lip too, so I'm gonna go up a little bit.
What did you use for numbing cream?
We have a BLT cream.
So 20 minutes with BLT. Oh, how long?
30 minutes to 45.
And you don't have to cover it in any way once you apply it for that time. Just, yeah, I figured, you know, some of the others, in terms of this, but using that, yeah, you know, when we did in the ER stuff, you would cover it to, until it was ready. Not in an open wound, see it in the closed wound or, yeah, just, and it also helped to,
When you are rubbing it, does it feel like an oil, or does it feel
Feels very soft. Very soft.
But it dries
But
really
your eyes
fast.
like
And you feel like,
yeah?
Yeah.
And then when it dries,
Yeah.
so you like to use it like as a nightly
I like that.
cream.
Yeah, you.
are you a doctor?
That's how I was thinking.
Oh,
It looks like
What's
a-
the protein?
looks like a great, you know, right before you go to
I
bed,
like to
put it
put mine
on.
on really
Let's
quickly.
know.
Yeah.
But remember, this is just one product. You can't put it out with the blood product.
It gets
So those nights you can't kiss.
Exactly. I don't know what all it is.
It's not, you don't
I
feel.
feel it in my lips.
Whatever, anyways, he's in your.
I love it.
Okay.
We probably should.
Strong.
Works. One of my clients.
And we go higher for.
Yes, this is about 2.
So,
A little bit less than 2. But I'm already
you know what I mean?
about 2.
But I think
I have one in Jersey, what causes
I'm telling you, I've never had that.
I also have one
Because it's not that deep.
literally
I just not
2
feel
miles
it
from
like
my house. That was like this neighborhood pharmacy, and then all of a sudden they became an infusion
Because they
therapy,
see all the peels, chemical peels and everything, they produce more of a heat damage. This is, but I think it never hurts.
it doesn't hurt you.
Yeah.
How's mom doing?
I told you that. If they have a history, you
Oh,
should.
who's drawing
If
blood?
they have a history, you
Are
should.
they still
So
drawing?
now I have a little bit remaining.
Not right now.
So I'm going to show you how to do the
Okay,
cannula injection.
you guys, this is important, because if you want cannula, then. You better listen right
Better listen, you got your blood drawn, right?
Yes.
I'll take this.
Do you want me to start numbing it?
No?
Well, we should have it.
No, because we still have to do.
So I'm going to
Maddie, she didn't take it as a, always so tricky.
Well, we're about to get one.
Thank you. How was that, Mom?
Hey, Mama? What happened? Oh, don't worry about it. Okay, so we're gonna do some injections for her. Are you getting me cannulas, please?
Pronto.
Who has to get it? Amy?
Amy. I need a 27 gauge. 30 is fine too.
27 gauge might be you. You're right there. Yes.
She's.
For me. So I just pull my mommy. She doesn't like that. She's not saying anything. But if it was you guys were not,
She
she'd
is
be running away.
Super hero today. Oh, I can tell.
Was that a 27?
Here's what that is. It hurts.
This is cannula.
There's always, when I'm done this whole thing, it's always harder.
She's probably going to be going.
So, right in the thing, so I'm gonna make the channel open, but you see how I'm going back and forth, just get the channel open.
Is it?
A very anxious person, so
It's my shoes too, though. I have those wet.
patience, I'm not like that.
What's the matter, man?
So it never works for somebody who,
change your mind.
I wanna go
Yeah,
there.
really, no,
So
none
you
of
see,
that.
I'm right at the end of the area, so I'm gonna inject in that area.
Now the numbing helps this. Is she
No,
feeling?
it does not.
No, she feels all of it.
It doesn't
It's
hurt that much.
deeper, that's why.
Yeah, it doesn't hurt that much. It
Okay.
feels
Just
funny.
the
Because
initial
I
injection.
do my own injections and I do it with cannula.
Uh-huh.
The first part hurts, and if you're near the nerve, it hurts.
Okay.
But otherwise, it's really just pushes the tissues around, and it really it feels really weird, and so people don't like it.
Okay.
The way they feel, they don't like it. But from the opening that you make, you can go anywhere in the face with that.
Yeah.
Stay
that
back.
was pretty cool.
Sorry, it's just swollen here, but it gets absorbed and it goes away. Don't treat it like a filler. So this is not a filler, okay?
Do you use the PRP to plump up acne
This is not, don't
indentations?
mix up.
I know, choose Charlie.
They do read the.
Yeah.
Oh, he's the guy. Okay, good. All right, I didn't know. I wanted to see how much product we had left, that's all.
But doing it with a cannula, or do you do it more with a, just the needle?
We're gonna switch over and move over to the hair guy.
When I was
So
with
do
the guy I
you
used to
need
work,
me
used to do it just with
Right,
the
do you need to do anything? Do you
Fill
have,
those popcorns.
Doris, do you have,
You
like
can
30
do
days?
anything just
It's
with
called
the
Start
nerve.
to seal it, when you actually go in with the needle.
No, like their scars.
Yeah,
They're not
some
putting
scissors.
anything
They're
in there.
Or if you dirty regular needles.
You just put, you would put PRP in.
Okay, I'll go get you some.
Putting a needle in. Just.
But see, if I wanted to get, my point with the needle is if I wanted to do all of these with the needle, how many needle would I would have done?
Yeah.
So, it would have been too many needle pricks for her to get all that area treated.
It doesn't move as easily.
Yeah, so that's the reason I like the cannula. So, and I don't like to do needle because really it's gonna be too much. And then,
The 30 gauge.
even though she bleeds a lot and she's an easy bleeder, but you don't see much of a bruise from her.
Right.
I mean, I don't have any bruising here. Even though she was dripping, but I don't have a bruise. And that's, if I get a bruise, it would be from the needle that I put in. But from the cannula, you're not gonna get a bruise. So, if I wanted to do this, all of that injection that I did with the needle, what would the person look?
Yeah.
It would look horrible. So you can let her go, and by tonight she would be fine, but with the needle she would be all bruised up and not really looking good. So that's the reason I like the cannula. And I haven't used a needle for a long time. I really don't do any of the injections with the needle.
Where's your forehead place?
I usually put it here,
Put it here.
because
Just
this is
go
that
either
you
way?
can go anywhere, and I can come here, I can go in here. But there is one
Can't reach
one
that.
place that I cannot reach from here, and that's this. If I wanted to do the upper eyelid, and I want to go and the one that they have superior sulcus deformity, and I want to fill this area, I have to put one hole here because then I can fill this area and I can go and fill this area. The temporal waist, you really don't need a cannula. That's the only. Now I have to correct myself.
Yeah, right.
Yeah, this is just the needle. You go all the way to the bone and just inject right on the bone.
Okay.
Because you're acting like you wanted to do like an implant, and what we do, where we put the implant, is that's where we put the implant. So you don't want to be anywhere superficial here. There are too many nerves and too many vessels here that you do not want it to mess up with. So you want it to be all the way to the bone, and you go straight 90-degree all the way to the bone, and you inject right on the bone.
A bolus. About how
A
much?
bolus. You can put as much until it comes up, because there's space right there at the plate, and it can you press it and it this
Okay.
bursts all along
Okay.
the bone.
Okay.
So you can put as much and it comes up,
Okay.
and you're not going to do any damage. There is not going to be any problem there. If you're superficial, yes, you're going to be a problem here. So you don't want to be any superficial injection in this area. That's another problem. Even though it's not in the triangle, but this is a problem. Do not use it like a needle injection, like they call it threading injections. Don't do it. Or serial injections. You don't do that, because this is a bad area. You have a lot of artery nerves and all kind of things. You have your facial nerve coming up here. It is very sensitive. You inject near it, it will cause your eyebrow drop. So you don't want to do that. You have your facial artery here, so you can cause serious problems. So do not inject in this area, like the way you do in these areas. Okay, Mama, you okay? Allergies are always awful.
How
on
about
this
the
side.
other side?
I'm sorry?
How about the other side?
Yeah, so we need to get some more blood for her so I can do some more.
Oh.
We ran out.
Okay, do you want to, because that's gonna take
Yeah,
10
sure.
minutes, shall we
Yeah.